I would like to introduce our very distinguished guests on the panel. First is Dr. Alex Parkhouse. He's a medical sociologist here on campus and professor. Next we have Dr. Scott Mansky, who's a resident physician in internal medicine at the University of Maryland Medical Center. Next is an assistant professor, Dr. Neil Segal, who's also a health systems delivery scientist. We're very lucky to have him here tonight. Also from the School of Public Health, Dr. Dylan Roby, who's an assistant professor and health policy researcher. And last but not least, we'd like to welcome Dr. Andrea Lopez, who is a medical anthropologist from the anthropology department here on campus. So our goal with this panel was really to help everyone here develop a better understanding of how each perspective and each discipline contributes to our understanding of healthcare and illness, and how each application of these perspectives can contribute to the overall improvement of the patient healthcare paradigm. So first off, I'd like to ask each of you how you got involved in the field of study and profession you are now, and maybe highlight a few things about how you got there. You want to down the line, or as you feel? Up to you.
Okay, well, thank you, John. And it's great to see a number of my students. That's really fantastic. I guess a little bit of my background and how I got interested in medical sociology in particular. Quite a few years ago, I had entered, probably much like many of you in here have, as a pre-med student. I was really focused and had an ambition of going towards medical school to become a cardiovascular surgeon. I really had my mind set on that. That's what I was going to do. And then I recall back to my early days of my undergraduate career, and I sat in an introductory sociology course. And I remember for the first time really kind of questioning everything I knew. Everything around me was sort of this dynamic that I never really recognized. And as I sat in that classroom, I was really inspired to kind of investigate those conversations a little bit further. And as we got to the medical sociology section of that class, I really was just sitting there, wow, my mind is blown. Right? I left the class and said, how can this be? You know, I never viewed medicine in this way. I never really looked at the patient-physician interaction in this way before. Could it be possible that I could still help patients and practitioners if I wasn't in the medical field itself? And that was really that turning point for me where I said to myself, wow, this is a really great opportunity to investigate sort of that dynamic between the patient and physician, or even looking at illness in particular from a cultural lens. And that's when I switched from going into the medical field into medical sociology, and ever since I've been involved in the education side and research side of medicine.
So I'll say it's good to be back at the University of Maryland. I'm an alumnus here. I think I was fortunate enough to come into college knowing I was interested in science and particularly health. So I was pretty much gung-ho, I was pre-med. I really enjoyed just learning about the body itself, the interactions that each organ has on each other. I thought it was fascinating. And in medical school, that was definitely confirmed. I loved everything that we learned. The hard part was not choosing to go to medicine, but choosing which part of medicine to do. And then internal medicine, because you get a pretty good breadth of number of medical conditions, and you get to see everything, and have an opportunity to get a further specialized down the line.
Good evening. So